Good afternoon, everybody. My name is Dr. Ted Mitchell. I'm the Chancellor of the Texas Tech University System. Welcome to our virtual town hall. This is entitled, This is Your Shot, Vaccine Facts and Science. We're really blessed to have with us today experts from our two health-related institutions, the Texas Tech University Health Sciences Center and the Texas Tech University Health Sciences Center in El Paso. I want to give a specific shout out to the leaders of those institutions, Dr. Lori Rice Spearman, who's the president of the Health Sciences Center, and Dr. Rick Lang, who's the president of the Health Sciences Center in El Paso. Their teams have done a remarkable job, not only in helping our entire system navigate everything that we've gone through during the pandemic, but in putting this program together. Because we're not quite out of the woods yet. I want everybody to think with me for just a minute about a football game that you're attending. Your team's ahead, and you have a chance to score another touchdown. You see the wide receiver break free and run right down the sidelines, and he's past the defense. You know he's going to score. He's so excited, he looks over his shoulder to get the ball, but before he catches it, he runs into the end zone, dropping the ball, not scoring a touchdown. That's where we are with COVID-19 right now. We got so excited when the vaccination first became available. We were having people get vaccinated left and right, especially high-risk people. And what wound up happening was we really saw the numbers drop, the number of hospitalizations, the number of people getting sick, the number of people in the intensive care unit, the number of deaths. They all started plummeting. We were all ecstatic about that. But just like that wide receiver, we took our eye off the ball. And so as a consequence, we're now seeing the Delta variant pick right back up, and it's really problematic for all of us. So this virtual town hall is a way to get you information so that you can make decisions for yourself about how to keep yourself, your family, and your community safe. We're not out of the woods yet. We're going to encourage everybody who is eligible for a vaccination to get one. And today is the day you'll learn the facts about the shot, the risks from the shot, as well as the benefit to our community. So I hope you have a great virtual town hall. I hope you learn a lot from this, and I want to give thanks to everybody that's helped put it together. You guys have a great time with it.
Great, I'm Rick Lang, and it's my pleasure to welcome you, my colleague, Dr. Lori Rice Spearman, and myself, welcome you to our community town hall. Before we begin, we have a message for our Spanish-speaking audience.
Hola, buenos días, señoras y señores. Mi nombre es Lucrecia Rodríguez, voy a ser su intérprete en español. Tenemos al señor Rick Lane, quien bienvenido, le queremos dar la bienvenida a esta reunión aquí de la ciudad. Ahora, cuando encendamos el servicio de interpretación, por favor, van a encontrar un icono en la parte baja de su pantalla que va a ser con un signo de planeta. Por favor, chequee ahí, elija el español para poder escuchar todo este audio video en español. Muchas gracias. Thank you, Mr. Lane. You can continue.
Great, Lucy, thank you very much. And I think what you can appreciate is we're reaching out to our entire Texas Tech University family, but the entire region, because we really touch all regions throughout Texas. And it's our desire to give you the latest information and facts regarding vaccination, and they're changing on a regular basis. Now, Dr. Spearman and I have had the privilege of assembling a group of experts from our universities. It'll be a Q&A period. We have some questions we prepared, major questions that we've addressed or that people are asking us, but there'll be a chance for you also to ask questions. So I'm going to turn it over to my colleague, Dr. Rice Spearman, who's going to give us a little bit more details, housekeeping details about what's going to happen over the next hour. And then we'd like to introduce our experts and then get started. So Lori, it's yours.
Thank you, Dr. Lang. We're looking forward to this town hall today. Before we get started, we see many participants are jumping on. We want to answer your questions. So if you do have questions, if you will use the question and answer part of Zoom, we have a team working behind the scenes to assemble those questions and get them to us at the end of our expert panel questions. Prior to this, we worked to make sure that we were going to initially answer some very common questions that we have coming into both of our institutions across our communities. And so, Rick, at this time, I'll hand it back over to you and you can introduce our El Paso experts.
Lori, thanks. So we'll have three experts joining us from El Paso, Dr. Armando Mesa, Dr. Mesa is an associate professor of medicine, and he's the chief of infectious diseases at our institution. And he's played a very prominent role in El Paso's response to COVID-19 pandemic, and actually represented our university as an expert in both local and national media. So Dr. Mesa will be joining us. Dr. Sirisha Reddy is the professor and chair of the Department of Obstetrics and Gynecology, again at our university. She serves on the obstetrics committee for the Texas Collaborative for Healthy Mothers and Babies. Now, this is a group that advances safety for Texas mothers and their children. Dr. Reddy is passionate about prevention and education to improve health outcomes. So it will be great to hear from her. And then finally, Dr. Glenn Fennelly. Dr. Fennelly is the professor and chair of pediatrics at our university. Besides his medical degree, he has a master's in public health from Harvard. And this has helped him to address children's needs on the border, a really underserved area. He's also a pediatric infectious disease expert, and he has a special interest both in COVID-19 and its impact on children. So Lori, those are the experts we'll be bringing to the table. Let us find out about yours.
Well, it's my pleasure to introduce Dr. Ron Cook. Ron is a tenured professor in the Department of Family and Community Medicine in Lubbock. He also serves as the chair of that department. Dr. Cook has also served as the health authority for the city of Lubbock and was recently appointed the chief health officer for the Texas Tech University Health Sciences Center. In addition, we also have Dr. Teresa Baker. Teresa is a professor in the Department of Obstetrics and Gynecology at the Texas Tech University Health Sciences Center in Amarillo. She is the co-director of the Infant Risk Center while also serving as the residency director and regional department chair for obstetrics and gynecology. She is board certified with the American Board of Obstetrics and Gynecology, as well as a fellow with the American College of Obstetricians and Gynecologists. And then we also have Dr. Jeff Dennis. He's an assistant professor in the Julia Jones Matthew Department of Public Health and director of the Masters of Public Health Applied Practice Experience. Dr. Dennis is interested in public health messaging related to the COVID-19 pandemic and has collaborated on 2 community surveys examining factors related to COVID-19 vaccine hesitancy, results of which were recently published in the Journal of Primary Care and Community Health. And finally, we have Dr. David Edwards joining us, who's an associate professor in the Department of Family and Community Medicine here at the Health Sciences Center in Lubbock. Dr. Edwards serves as the medical director of the Texas Tech University Student Health Services, and he practices primary care and musculoskeletal medicine, serving children and adults. So at this time, Dr. Lang, I will hand it over to you and Dr. Mesa to begin our first questions.
Lori, thank you. Even as we're about to ask our experts questions, there are already questions rolling in on the chat. So Dr. Mesa, I'm going to address the first 2 questions to you. First, why are some individuals still contracting COVID-19, including the Delta variant, despite being fully vaccinated?
Well, first of all, thank you for the invitation to participate in this town hall. And I think that the best way to answer this question is related to what is it that the vaccine has the intention to do primarily. And as we know, when the studies that were done for the vaccine development, there was one main goal. And I want to emphasize that that goal still is being met by these vaccines, which is prevention of severe disease. What does that mean? That if you get vaccinated, you are protected by a 90% plus chance of not ending in the hospital. Now, when the studies were done, we saw an additional benefit, which is protecting us from becoming infected with this virus. As the virus has unfortunately moved on into variants, some of these variants, including the Delta variant, have less ability to be protected the individual from the vaccine, from this infection. Now, I want to again emphasize that the majority of the patients who are in those hospitals admitted with severe COVID are vaccinated people who refuse or decline or did not choose to get the vaccine, as opposed to those who have received the vaccine. So despite the Delta variant still present in your body, It will not lead you to a severe degree of infection. And that is critical for those individuals who still are hesitant about receiving the vaccination. I think that's a very critical, important element. Now, we know, and I think that's going to be something that will come, and we already have heard about it, some vaccination individuals that have developed the antibodies may not have the amount of antibodies that are protective. That is that they may still need to be boosted by a dose, and I think that's probably one of the reasons why they may end up being infected despite getting their full dose vaccine schedule.
So I'm going to summarize that. What you're saying is that even with the Delta variant, the current vaccines we have are still effective at preventing serious infections, including hospitalizations and death.
Without a doubt, without a doubt. Those two objectives have been met without any problem still to this day.
Okay. Well, and since you mentioned booster, I'll follow up with a second question, Dr. Mesa. Am I going to need a booster, and why?
Many individuals, and that's been already seen and studied, they were not able to develop the amount of protection that was intended with the 2 doses, or even with 1 dose with the other vaccine, the 1 dose. So what we are trying to do is, if those individuals who were not as protected are the primary target for these booster vaccines, I think that's a very good reason to do it. If you are healthy otherwise, and you have developed the normal protective reaction that the vaccine was going to give you, you may not need to be receiving a booster dose. Now, we have identified, the CDC has already defined what are those high-risk population individuals that will benefit from a booster dose. And I'm pretty convinced that this is going to be the primary group of people that we are going to end up being vaccinating. And the objective is that they receive equal protection as those who are healthy and have received the vaccine. And I guess the remaining question is, are people who are healthy, who have received the vaccine, still going to need another dose? That may end up being the case in some scenarios.
All right, and I'm sure this will come up on subsequent questions, talking more about the booster. So don't leave the town hall. So, Lori, I'm going to turn it back over to you so you can address some questions to Dr. Cook.
So, Dr. Cook, there remains a lot of controversy over the safety of vaccines. Could we ask you to review the current data and its safety?
Absolutely. Thank you for that question. Let me talk a little bit about our community, which is probably similar to Amarillo and to El Paso and our other communities that are listening. 90%, just like Dr. Mesa said, 90% of our hospitalized patients are unvaccinated. Right now, the average age of the hospitalized patient is 53. The average age of the person on the ventilator is 48. This is affecting a much younger patient population. This is all the more reason why we really want you to go out and get vaccinated. And I'll talk about the safety, especially of these mRNA vaccines, all the vaccines. The vaccinologists, the scientists that study vaccines, they've been studying this mRNA vaccine for years. It's not new. We just heard about it when COVID hit. So it's been studied for years. And is it applicable for cancers? Is it, and you remember Zika from 2015, I think, when Zika hit, we were about to use an mRNA vaccine. So they had done all the work getting ready to use these vaccines, and then COVID hit. And now, so just briefly what they've done, sometimes when an FDA approves this vaccine, they have 3,000 patients enrolled. Both Pfizer and Moderna had over 40,000 patients enrolled in their preliminary studies before they went to the FDA to get emergency authorization. So they had 80,000 plus patients. They were held to the same safety standards, just like any other vaccine. And so now today, we have had more than 357 million doses of this vaccine given and had relatively few, tiny amounts of abnormal reactions or adverse events. And that's where we report, those of us that give vaccines, we report these events to the adverse event reporting system. And that's how we pick up these adverse events. And so my concern is, I want to address your concern. Is this vaccine going to cause something way down the road, 2 or 3 years from now? two reasons why that won't occur. One reason is that when we inject you with that vaccine, it's gone out of your body within a couple of days. So it can't hang around and continue to do things. If I give you a new drug and give it to you every day, like a new diabetes drug or a new hypertensive drug, we're going to give that to you every day, but it's going to be years down the road before we might see something. With this vaccine, it's gone in a couple of days, so it can't continue to do anything, but it's in your body long enough to stimulate your immune system to say, hey, that's a spike protein and I should do something about that. And then the other thing is, the other safety feature here is that when we give you a vaccine, we usually see the a severe reaction within a week or two. And that's what we saw with a few things. We've seen a few things pop up like blood clots and Guillain-Barré, which is a nerve disorder, or heart inflammation or myocarditis. We've seen those pop up on rare instance, but we expected to see that because we knew the event reporting syndrome or system. And if you get COVID or you get measles or you get chickenpox or some of these other viruses, we see those things pop up anyway. So we knew this was not a particularly new virus like that. And so we expected those things to pop up, and we caught them very early. And they usually happen a couple of weeks afterwards. So for those two reasons, we were ready for those. And they happen so very, very rarely. And we know how to treat Guillain-Barré. We know how to treat heart inflammation, and we know how to treat blood clots. We've changed the way we treat them a little bit, but we know how to treat them. And that's good news, and we're ready for them if they do pop up. One last thing I want to address is it's all over the internet, all this disinformation about how many people have died from the COVID vaccine. Let me tell you straight, it is only 3 people have died from the COVID vaccine. And that was early on when we saw blood clots come up, and 3 people have died from that. We know how to treat this. We've changed our way we treat it a little bit, but only 3 people have died from the vaccine out of, in the United States, 357 million doses. Those are pretty good odds. You have a greater risk of developing a blood clot if you get COVID than you do from the vaccine. It is a very, very safe vaccine for all individuals. Yes, ma'am.
Ron, can you also address FDA approval? We've had some folks express some concern around FDA approval.
FDA approval for a new drug, even vaccines, is a very arduous, a difficult process to make sure that drugs are safe and that we monitor all the side effects and bad outcomes. So we monitor those through that adverse event reporting system, or VAERS. The first thing that happens is you're a scientist, hey, I think this drug or this vaccine might work for this. So that's phase 1, and that's preclinical. And then we take it to the lab and we say, oh yeah, see, we can make an antibody and it attacks the spike protein. Now we've got to prove it. Does that really happen in people? Not in the lab, but in people. And so they sign up a very few number of participants. That would be phase 1. And if all that works out okay, then they move to phase 2, and they enroll several hundred patients. And if all that works out, no red flags, then they move to phase 3. That's anywhere from 3,000 to 3,000 participants. And it may take, especially if it's a drug like a blood pressure drug or a diabetes drug, they're going to monitor it for 1 to 4 years. And so that takes a long time. Now, we didn't shortcut the vaccine because vaccines are given once, maybe 2 doses, and then we wait for the response, that 2 weeks. That's why we can move so fast on these new vaccines. So if we give an example, I give you a new drug, and we're going to take it twice a day for 4 years with 3,000 patients. That's about 8.67 million doses over 4 years. We have given 357 million doses and have seen very little side effects, very, very rare side effects. So we've given 357 million doses and very few. That's sort of the process. And like I said before, instead of 3,000 people, both Pfizer and Moderna had 40,000 plus in each one of their studies to prove to the FDA that this is a safe drug. And it's very, very effective, as Dr. Meza said, preventing severe disease.
Thank you, Dr. Cook. And Dr. Dennis, we see you on the screen as our public health expert. Can you talk to us from your perspective of why does slowing the spread matter?
Absolutely. Thank you for the opportunity, Dr. Rice-Spearman. So currently, as Dr. Mitchell said in the beginning video, we are seeing this increase with the Delta variant, which is, we're now seeing the hospitalizations increase pretty rapidly. And so slowing the spread right now relates to really conserving our hospital capacity. And, I think it's important for us to remember, it's become increasingly apparent that we're not just talking about physical beds when we talk about this, but we're talking about the staff to be able to work with patients and to monitor patients in those beds. And so certainly we always want our hospital to have a bed for us or for our loved ones or our friends when we need it. And so I saw the Texas Tribune is estimating that there's about 16 million Texans who have not been vaccinated. And, about a third of those are children who are not eligible. They're under 12 years old. About 2/3 of those are people who, for whatever reason, a variety of reasons, have not gotten the vaccine at this point. And so obviously our system is not set up for everyone to get sick at the same time. And we're very fortunate that hospitalization rates in young children remain fairly low, but again, we don't want to test it too much, right? We have to be really careful monitoring that. And so I think that's the main thing, is we have a substantial unvaccinated population. So we have to be careful about letting the spread go too quickly in that very large population.
Thank you. And also, Jeff, what is your recommendation with your expertise in communication around this? How do we communicate the need for the COVID vaccine to the members of our community and maybe even our own families who are somewhat or strongly opposed to receiving the vaccine?
Absolutely. I think this is something that I've spent a lot of time thinking about over the past year, and certainly we have very strong opinions out there. We've gotten tied into a lot of politics, and I think we have a privilege at the Health Sciences Center specifically. We have so many experts that we can get really good information and people who know how to interpret different kinds of information very easily. And we have to remember that not everybody else has that access. And so I think it's important for us to communicate, but it's also really important to listen. We have to remember that a big part of communication is listening to what people's concerns are, right? These are people with a variety of different perspectives, and if they've not gotten the vaccine, there's no single thing that's going to change everyone's mind. That's one thing that seems pretty apparent. And I think certainly there is going to be a population. There's some percentage that probably will never get the vaccine. We're probably working more right now on the people who are still on the fence. Certainly, as we've seen the hospitalizations increase over the past month, vaccinations have gone up again. So, one factor obviously is people see the risk. They've now had 9 months or so to see the vaccines, what they have done in terms of hospitalization and severe illness. Versus what COVID-19 has done in terms of getting the illness and what your odds of hospitalization or death are there. And so, we know that people who are more at risk, generally speaking, were more likely to get the vaccine. But I think it's really important to, in my mind, not dismiss people who have theories, even if their reasons seem very fringe or out there, right? It's about listening to them and trying to meet them where they are and say, I understand that this is your concern. Let me talk through some facts that I think are really important to this conversation. And not everybody's going to give you the opportunity to have that conversation, but where we can, I think that's really important. And so, because I do think if we dismiss people, the likelihood is they're going to go to somebody who will validate their opinion, right? And that's only going to cause them to dig in and not listen to evidence that we may be trying to provide. So I think we have to do our best to give clear, up-to-date information, and we have to be, very transparent when the data changes, when we learn something new. even if it's contradictory, we have to just be as transparent as possible and give people hopefully the most current information, and honestly not speak past our expertise. You know, I think it's okay to say that's a great question and I don't have a direct answer, but let's keep this conversation going.
Great, thank you, Jeff. Okay, Rick, I'm going to turn it over to you and Dr. Reddy.
Great. So Jeff, that's a great segue because you talked about providing new information. So we're going to turn to Dr. Reddy. And I'm going to ask you about vaccination during pregnancy. But before I do that, Dr. Reddy, I first want to ask you, what are the risks associated with COVID-19 in pregnant women?
Thank you, Dr. Lang, and to the expert panel, as well as the participants in the town hall. So the risks, there's fairly good data now. We've had 2 years going through the pandemic, and it's fairly clear that symptomatic pregnant women or recently pregnant patient who do get COVID-19 are at increased risk for more severe illness compared to their non-pregnant counterparts. So if you compare the pregnant woman age for age to the non-pregnant woman, and if they're both symptomatic, the chances of that pregnant woman potentially having mechanical ventilation, an ICU admission, and even more advanced ventilatory support, meaning breathing support like an ECMO, and even death are a little bit higher than their counterpart who's symptomatic and non-pregnant.
Thank you, Dr. Reddy. I'm going to move now. Can you talk about what we know, not what we think, but we know about the safety and effectiveness of vaccination during pregnancy, because it affects the mother and the newborn. And I'm going to ask you to address one other thing, because there were some concerns, even among women that aren't pregnant, but may want to have a child. They're hearing rumors that, in fact, the vaccination can affect their ability to bear children later, their fertility. So if you'd address those.
Sure. For your first part, the infertility aspect or affecting infertility, really there's fairly good evidence now through the VSafe data that there's really been no scientific evidence to support, fortunately, that claim. And so really the body of organization that I look up to, the American College of OBGYN, has really pretty firmly has said that the claims linking COVID-19 vaccines to infertility are really quite unfounded.
And Sarisa, regarding the safety and effectiveness during pregnancy, both for the mother and the newborn, what can you tell us?
Yeah, in the very beginning, I have to say the bodies of organization that I mentioned, the American College of OBGYN, and then we do have another society which deals with high-risk pregnancy, the Society for Maternal Fetal Medicine. They were a little supportive, but they hadn't actually come out with the recommendation. And I am proud to say that in the last month, the American College of OBGYN has come out and does recommend the COVID-19 vaccine for both pregnant individuals and also lactating women, so against the COVID-19. As far as the evidence on the adverse outcomes for both maternal and the mom and the baby, we have quite a bit of data now, and it continues to grow. And as many of you have probably, who have received the vaccine, have probably received a little sheet saying, please register for the VSafe, which is sort of the health registry of the CDC. And from that body of data, we have had about 136,000 women as of beginning of July of this year, essentially looking at side effects and some maternal complications and neonatal complications. And out of those complications, in particular, when you compare in the VSafe data to the background rate for both gestational diabetes, hypertension, preeclampsia, eclampsia, many of the complications, none of these have really reached above the background rate, meaning if COVID-19 wasn't around, how often do these pregnancy complications occur? And after these women have had the COVID-19 vaccine, in some of these, the complications were even less than the background rate. And the same thing applies to the neonatal outcomes. There were some thoughts about preterm labor, congenital anomalies, and none of these have proven true in comparison to the background rate. They don't even approach the background rate.
Thank you, Dr. Reddy. Lori, let me turn it back to you.
Dr. Baker, Dr. Reddy touched on this a little bit about the safety of the vaccine for breastfeeding moms, and also what happens when a breastfeeding mother tests positive for COVID-19. Can you talk us through some of this?
Yes, they have shown that women who receive the vaccine, they do pass antibodies to their infants, both through the umbilical cord and also through the secretory IgA in their milk. So there is some immunity that's being passed to the infants for those that choose to be vaccinated. Dr. Reddy's right. It's frustrating, but they did not include pregnant or lactating women in the initial studies about the vaccine for various reasons. So we're extrapolating some data, but all of the major organizations are saying it's safe, and it's certainly safer than getting the COVID virus. So that's the only leg we can stand on right now.
And Dr. Baker, while we have you on the line, can you talk a little bit about the Infant Risk Center and the resource that provides to women all over the nation, should they have concerns or questions about breastfeeding and what can pass through breastfeeding?
Yes, we run the Infant Risk Center here, Dr. Hale and I. I really liked what Dr. Dennis just said about listening. This is a very vulnerable time for women and their children, and they're trying to make the best decision that they can. And we would love to help you sort through those decisions. We're getting thousands of calls and hits on the website every day asking about the treatments that are available, what's safe, what's not safe, how to make the best decision. And we would love for you to contact us, and we'll tell you exactly like Dr. Dennis just said, we'll tell you the most information we have. And that sometimes is not sufficient for people to feel really confident in their decision making, but we're at a place right now that we have to just do the safest thing for moms and babies and be as honest as we can about what the data does show.
And we'll make sure that we have your information in the link as part of this program. Okay, Rick, I'm going to turn it back over to you and Dr. Finley.
Right. So Dr. Baker, another great segue, because you mentioned vaccination in kids. So Dr. Finley, a great question. Is the vaccine actually safe for children?
The bottom line is that the vaccine has been approved for 12 and over, or children 12 to 17 who couldn't be vaccinated. That approval came several months ago. Bottom line is the vaccine is safe. And to address two concerns up top, one that we hear a lot about is, again, the fertility, particularly in a male adolescent. It's what I refer to as a vaccine trope. It's not true. There's more harm in propagating that misinformation in terms of potential lives lost. The vaccine is safe in that regard. The second concern I will also confront head on, and that's around pericarditis, myocarditis. There's no question that younger adolescent males, 12 to 17, are at the highest risk for this complication. It remains relatively rare. If you balance that risk against the overall benefit of keeping a child out of the hospital, keeping a child out of the intensive care unit, then there's a net benefit. Now that risk benefit was sort of looked at a time when we weren't dealing with the Delta variant. Now that we have the Delta variant, there's no question that a higher proportion of children are getting infected. Therefore, we're going to see many more sicker children. The virus may not make a child sicker, but a higher percentage of children in our population will get sicker. So again, the net benefit is much greater than it was when that analysis was first done.
Great. And Dr. Finley, that's great information, and a lot of it. I'll remind you that our Spanish interpreter is interpreting it. She's going to ask you to speak a little bit slower for the next one, because she doesn't want to
Más lentamente.
See, she doesn't want to miss a word of it. So the follow-up question to that is, okay, so you said it's safe. So I have a child who's young and they're healthy. Why do they need the COVID-19 vaccine?
Again, that's a great question, and I will respond to this with sort of about 3 major points. The first is anybody at any age can get very sick from COVID. So number 1, it's for sort of selfish reasons. You want to protect your child the same way you have your child wear a helmet when they go bicycle riding, or you put a seatbelt on them. The risk of injury is low, but if it happens, you want them to be protected. The second is somewhat more altruistic. We know there are children in our communities that cannot be effectively immunized. Children that may have had a solid organ transplantation, a kidney transplant. The vaccine may not work well with them. That could be the child sitting next to your child in the classroom. So in a way, you're sort of donating your protection to them. The third also is somewhat altruistic. On a population basis, the emergence of Delta variant may have been driven in part by unimmunized children. If we take children less than 18, that makes up 25% of the population. Without them being immunized, we're not going to get to herd immunity. So the next frontier will be the children below 12. There is evidence pouring in that the vaccine indeed is very effective, probably at a lower dose. And we look forward to an opportunity maybe as early as the fall, if not before the year is out, where we can immunize younger children to prevent the spread of other variants in the community. Another consideration in children is, even though the child may not get very sick during the initial or acute illness, so-called long COVID, that may happen in about 10 to 15% of children. We don't yet know what the long-term effects are in terms of their ability to learn, for example. So those are the reasons that the vaccine is not only safe, but there's a very compelling argument why in time all children should be immunized once the vaccine is shown to be safe and effective in younger children.
Great. Thank you, Dr. Fennelly. Lori, I'm going to turn it over to you for our last 2 questions, and then we'll get on to some of the questions from our listeners.
Sounds great. We have Dr. Edwards here today, and Dr. Edwards serves as our representative and our expert as our college students return to campus and serving those campus communities across our system and across the region. And so, Dr. Edwards, a question that we get from parents of these students who are coming back to school or coming to school for the first time is, why should a young, otherwise healthy person take this vaccine prior to coming back to campus?
Well, thank you for that question, Dr. Rice-Spearman, and thank you for the opportunity to participate in this panel discussion. You're right, we do receive that question quite a bit, and I would respond initially with the old adage, prevention is better than cure. And as we're seeing with this now 4th wave of COVID infections across the world, the Delta variant is primarily driving this wave. And what we've seen, especially in Europe and even here in the United States, is that the spread of this variant is primarily through younger people. And so we see our adolescent population, our young adult population as key in terms of maintaining their health by vaccination. And then more importantly, or just as important, to reduce the risk of spread to others, as the previous panelists have so eloquently informed us about. We want to avoid prolonged symptoms from infection. And there's more and more research that indicates, especially in adults, that up to 40% of people can have prolonged symptoms. The usual infection of COVID-19 lasts about 10 days, or in some people less. But what we're seeing in up to 40% of cases includes symptoms such as prolonged fatigue, headaches, loss of taste, loss of smell, prolonged shortness of breath, and even mood-related symptoms, primarily anxiety. And those can last for weeks, or in some people, even months. So, this vaccine, as Dr. Cook mentioned, is very well studied. And in general, for most people, the benefits of vaccination outweigh the risks. And so for the young, otherwise healthy individual, it's really important to receive the vaccination for the sake of his or her own health, to avoid spread to others, and to avoid the possibility of prolonged symptoms once infected.
And Dr. Edwards, but before you step off, I just want to reiterate to those individuals who are listening today, who are part of our component system universities, we have the vaccine readily available for students and faculty and staff who wish to take the vaccine. Second, we also have some of our independent school districts who have joined us today, and many of our cities across the regions in which we serve. We have vaccine readily available in our communities, so please reach out to your communities, your community leadership, and we will ensure that you get access to vaccine should you need it. So at this time, Dr. Lang, I think it's time for us to start working on questions that are coming from our participants and share those with the panel.
Right. So Lori, I can see we have over 100 Q&A questions right now. Obviously, we're going to finish in the next 15 to 18 minutes. So I'll ask our panelists to keep the answers short. Lori, I'll take 2 questions, then I'll turn it over to you to ask 2. So if you can see them, and I'll just ask you to randomly pick.
That's great.
Great. So I'm going to pick 2 frequent questions. One has to do with the booster. Dr. Mesa, you talked about the fact that people that are immunocompromised should get the booster. That is, people that may have cancer or cancer treatment or on steroids or have HIV or being treated. What about the need of booster in otherwise healthy individuals? And should you get vaccinated if you had COVID before?
Right. So what we know, and it's going to be probably determined by the science, is if you are an individual, let's say healthcare worker, or anyone that is heavily exposed or at risk of exposure, I think there will be some, I would say, understanding that a booster dose may be beneficial for you. And I think that's an important aspect that will have to be taken into account because as we did with the initial phase of vaccination, there were some priorities not necessarily made on the health of the individual, but on the risk factor. Now, these booster vaccines obviously are going to have to show eventually that they meet their goal, and that the goal is to protect us from getting infected and passing this. So I think that's an important aspect of these booster shots. The second question was related to what? I'm sorry?
If someone had the COVID infection, do they need vaccination?
The answer is absolutely yes. There's been actually a lot of data showing that when you have COVID and you have immunity developed from the disease, you still need to get a booster or a dose or a vaccination to augment that response. In a way, we know that when people have actually had the COVID disease, may actually benefit more than others with getting that booster dose. And unfortunately, at this point, and this is not something that I don't see as a major issue, is we don't have a way to test immunity in a way that is protecting us from the infection. So the safest and easiest thing to do is, as soon as we are past our COVID infection and disease, get our vaccination.
Dr. Reddy or Dr. Baker, somebody asked, we recommended vaccination for women who are pregnant. When during their pregnancy should they receive their vaccination?
There is no timing. You should get your COVID vaccine whenever you're able. There is no restrictions on when during the pregnancy.
Great.
Any time is a good time.
Great. All right, Lori, let me turn it to you.
Great. I'm going to go to Dr. Finley and ask him, are there any updates on when the vaccine may be available for children under the age of 5?
That's a great question and an important question. As I pointed out, maybe 1 in 6 people in our population are children under 12. So to get to herd immunity, we want to immunize them. So both Pfizer and Moderna have indicated that they will be submitting data. I believe Pfizer as early as the end of September that could lead to emergency use authorization for children down to 5 years of age. And Moderna may follow by the end of the calendar year. So we'll have to stay tuned in that there are trials now that have been expanded in numbers to look at the question to make sure these vaccines are safe, using a larger number of children and comparing to a placebo group.
Great. And Dr. Cook, I'm going to throw this question over to you. because I know this is one of your passions. Normally, we start getting flu shots in September and October. What advice do you have in terms of timing of getting the flu shot and getting either the COVID vaccine or the COVID booster shot when it becomes available? Should there be a wait time in between these vaccines?
We know here's the good news. Last year, we saw relatively no flu. And that's really because I think we're social distancing, wearing our masks and washing our hands way more than what we probably did in the previous years. So, but flu is still around. After we opened back up and quit wearing our mask, we saw flu start popping up out of season. So it still smolders around. So we saw that. So in relation to getting another booster COVID shot, and our immune system is amazing. It can see literally thousands of different antigens just walking through every day, especially the way the wind blows out here in West Texas. So it is quite capable of handling what we put into it. And so I believe that it is absolutely safe to receive your COVID vaccine booster and your flu vaccine. They'll be just fine. They are working on kind of two different things in your immune system. It's perfectly fine.
Great. Okay, Dr. Lang, I think we have time for a couple more questions.
Great. And one of the things that Dr. Mason mentioned is if you have been infected, COVID infected, that you still get vaccinated. And one of the listeners wrote, do we have to wait? And the answer is yes, just wait for 90 days after infection. So I just want to clarify that. I've had a couple questions that want people to comment, and I may turn this over to really any of our panelists. And that is the value of taking the vaccine or vaccinating in terms of preventing mutations.
So I'm happy to help with that answer. Anytime we're infected, we're shedding virus. And this virus isn't perfect, as many different viruses are, isn't perfect at putting itself back together on every replication. And so it'll spit out a mutant. Most of the time, those mutant strains or mutant particles that come out can't do anything and die off. But it's those ones that progress further that, like the Delta variant and the Beta variant and some of the other variants, they come from changing and trying to avoid the immune system. And so if you're not vaccinated and stopping that virus and preventing the spread to somebody else, if it's replicating, it's mutating. And so we got to stop the mutation. And the way we do that is by getting vaccinated.
Thank you. Dr. Finn, I'm going to address a question to you that somebody offered, and that is for the children that can't be vaccinated now, how do we keep them safe in school? And then somebody asked about really the value or virtue of wearing a mask. Is it really beneficial or not? So Dr. Finley, what are your thoughts?
Yeah, these are both great questions. And again, we have to keep in mind, we don't yet have an approved vaccine for children less than 12. Our children are back to school now for several weeks. Indeed, we know that the mask can prevent transmission with about 70% effectiveness. And children as young as 2 years of age can wear a mask. So we know how to send our children back to school safely. Even before we had the vaccines, we demonstrated that we could do this, but mask wearing is a critical part of that. So it's good to see over the last several days that many communities are making the smart decision to have their independent school districts mandate that. Because again, looked at purely from a scientific perspective, what works, what doesn't, what we know that the risk of the Delta variant spreading like wildfire through the youngest children is real. So we know masks can prevent that. So absolutely, and I encourage all communities to send their children to school with masks.
Thank you, Dr. Finley. Dr. Spearman?
Okay, Rick, I will pick up the next question. Why does the vaccine not have FDA approval? This is the #1 obstacle for me in convincing family and friends to take the shot. So Dr. Cook, you gave us such an eloquent explanation. If you could touch on this again for those that need to have that conversation with family and friends.
It's a great question. I think it is really forthcoming. Maybe next month, but I think we'll also see boosters, as Dr. Meza and I we both mentioned. We're going to see boosters come around. FDA approval looks for everything possible before they actually put a drug out. They don't want to have to recall a drug. So they're doing their process, and they're not changing their process as if anybody else was trying to create a new drug and say it's safe for the public. They're doing their safety measures. That's exactly what they're doing right now. And they're gathering data, and they take their job very serious. And so I think it's coming. I think it's just around the corner. I think we have plenty of evidence to show. I don't sit on an FDA panel, but it's around the corner.
And Ron, I just want to reemphasize a statistic, a scientific statistic that you shared with the group. And I want to make sure I get this correct. 357 million doses of vaccine have been given across the world. And we have had very, very little, any type of side effect or concern, correct?
That's in the United States, 4 billion across the world.
4 billion across the world. Okay, thank you so much. I think that's an important scientific fact.
Absolutely.
Go ahead, Rick. Any more questions?
A couple more. For those that have received a particular vaccine, either Moderna, Pfizer, or even J&J, and they're thinking about getting a booster, Dr. Meza, do we know enough information yet? Do they have to get the same shot, or should they get a different one? And by the way, do we, even those that have received the J&J, should they be getting a booster?
Yes, those questions have not yet been determined. What we know is that the booster dose is going to be the same vaccine. That is, it's not going to be a Delta variant adjusted vaccine. So it makes sense that you get as a first option the same Pfizer, Moderna. Now, is there any way that you can interchange or exchange, or if you got the Johnson & Johnson, add another dose? I think that's perfectly acceptable. I think Dr. Cook mentioned the immune system is amazing. It can handle any kind of challenge, especially with vaccines to protect. So I don't see why it would not be possible to, at some point, look into that option as using two different brands of products.
So Rick, we have another good question that came up, and I'm going to ask Dr. Edwards to answer this one. What are those who already had COVID supposed to do? Get the vaccine? One dose? Both? Everyone I know who got the vaccine after having COVID had a severe reaction. So Dr. Edwards, can you address that?
Sure, good question. So for those who have received or for those who've acquired COVID infection and recovered, the next question is, should they receive a vaccine? And the answer is yes. As Dr. Lang mentioned earlier, ideally that vaccine would happen about 90 days or so after recovery from the infection. There's a recent study from Kentucky that looked at this issue, and they took a group of people who were infected with COVID-19 from March through December of last year, and then they followed them over time. And some of the population were vaccinated, some weren't. And of those who were not vaccinated, they had a twofold higher risk of becoming reinfected between May and June of this year. So a vaccine does offer protection, and in particular, protection against reinfection and severe disease. Did I answer the question?
Yes, thank you, Dr. Edwards.
Okay, thank you.
Right. Dr. Meza, I'm going to ask you a question as one of our infectious disease experts. There are people that are reticent to take the vaccine, but they're looking for alternative ways to prevent infection. And they're asking, are there medications they can take or foods they can eat or anything that's known to prevent them getting COVID infected?
Yes. Overall, there's been a lot of information about vitamin D and vitamin C and many zinc and many other supplements that unfortunately have not been proven to be scientifically corroborated to protect. I think that is, in general speaking terms, I mean, good idea that you use them if you feel that it's something that is going to be, helping you, but not really scientifically proven. Now, we have something called the monoclonal antibodies, and monoclonal antibodies have been used from the very beginning of these, management of these patients. We have used them in patients who have been sick, especially those who have mild disease, who do not need to be in the hospital. But recently, they've been now recommended to be used for exposure situations. That is, I am a known case of exposure to a patient with COVID. I can receive those monoclonal antibodies to protect. The only thing that I want individuals and citizens to remember, the public in general, is those antibodies have a lifespan. They don't last forever. They are not substitute for vaccination. They are a temporary measure that you can use, but you still will need to be vaccinated eventually.
So what I'm hearing is we know that there are things that we can do: physically distance, wash our hands, wear a mask, avoid contact with individuals, but no medications or no foods or nothing available that can do that. I want to go, I've got one other question again on the studies on infertility. There's, again, Dr. Fenley, you addressed the issue with regard to men. That is, there's no evidence at all. Dr. Reddy, I want to turn it back to you because, again, we've had still some chat. What can you tell us about the studies, not what we think, but the studies about infertility in women and whether there's any cause associated with the vaccine?
Dr. Reddy, you're muted.
Yes, my answer to your question before was brief, and I sort of stated that it was unfounded, but actually just in June, and your particular question was which study really said that there may not be a link or there is no link, and it was specifically related to individuals that were going fertility treatments. And they looked at embryo transfer, during the embryo transfer, and they looked at three groups of women. Women who were seronegative, women who had COVID-19 vaccine, and then women who had COVID-19, the disease. So they looked at the seropositivity versus the negativity. And they found that the embryo implantation during their infertility treatments was not affected in any group of these women. And so this was a fairly new evidence. This was June of this year. And the study may not have come out, but anybody can reference the American Society of Reproductive Medicine. And it's in their fertility and sterility reports, and it's soon to be published, but that's the latest hot off the press data.
Well, there you have it. That's the science. Thank you, Dr. Reddy. Well, unfortunately, we're coming up upon the end of our community town hall. I want to inform our listeners that not only is it being done live, but it's also being recorded so that individuals can view it in the future as well. I want to thank everybody for participating. I'm going to turn it over to my colleague, Dr. Lori Rice-Spearman, to make any concluding comments.
Well, first, on behalf of Dr. Lang and I, we want to thank each of our panelists for sharing their expertise and knowledge of the COVID vaccine and its impact in our communities. Dr. Lang and I would also like to acknowledge our communications and marketing team at both universities, as well as the staff in our offices across the universities for supporting this endeavor and this important town hall. Again, we want to reiterate, there is opportunity out there for you to get your vaccine. And it's important that you do so to protect our communities, our patients, our family, and our students. So please continue to reach out, ask questions. We are here to give you the facts and the science behind vaccines. Thank you for joining us today.